your blood pressure medication is not working, it might not be your fault. You may just be taking the wrong one, and this is how to tell. That there are 5 types of blood pressure medications. 5 of them work in different ways, each one for different set of people. And you may be taking the wrong one, dealing with the side effect of the wrong medication and the side effects of your blood pressure that is not well. As a matter of fact, 30 to 40% of people who have hypertension are not at goal with their blood pressure control. I'm going to tell you the 5 types of antihypertensives we have and who should take what class. First class of drugs will be the ACE inhibitors. These medications usually end in pril, lisinopril, enalapril, ramipril. They work by blocking an enzyme that tightens blood vessels. So your blood vessels are relaxed and your blood pressure drops. You are likely to get ACE inhibitors if you have diabetes, if you have kidney failure, if you've had a heart attack, if you have heart failure, if you are under the age of 55 and you are not Black. These medications actually protect your kidneys and your heart on a long term. One of the side effects that you should watch out for if you're on this medication is dry cough. Some people can even develop swelling. If you have any of these symptoms, go to your doctor. There is an alternative for you. Statistics have shown that this class of medication can reduce death by heart condition in 20 to 25% in people who are high risk. One class of drug are the ARBs. These are the angiotensin receptor blocker. They usually end in sartan, losartan, valsartan. These class of drugs are the alternatives to the ACE inhibitors. They work in similar manner, only that if you're having side effect of cough with the ACE inhibitors, then this is the alternative drug medication for you. If you are diabetic, if you have heart failure, if you've had heart attack before, if you under the age of 55 and you are not Black, and then you're having a side effect of cough from the ACE inhibitors, then this is what you should get for an alternative. The calcium channel blockers. These medications usually end in dipines, like nifedipine, amlodipine. Some other ones are diltiazem or verapamil. This class of drug acts by blocking calcium from getting into your heart and your blood vessels. This will cause your blood vessels to relax, and it can also reduce your heart rate. The people who should get calcium channel blockers are people who are older than 55, people who are Black, people who have diabetes, people who have angina or chest pain, and people who also have problems with their heart rhythm. With the calcium channel blockers, you have to watch out for certain side effects like swollen ankles. It is very common, but it is not harmful. Some people can have constipation. Sometimes it can also cause some headaches. There is a fun fact with the calcium channel blockers. Amlodipine is actually one of the most prescribed medication in the world. Fourth class of drug are your water pills. Examples are the hydrochlorothiazide, clothalidone, as well as furosemide. These make you pee out that excess salt and water. And then when you have less fluid in your system, you have less pressure. You are likely to get a water pill if you're more than the age of 55, if you are Black, if you have heart failure, if you accumulate some fluid in your body, or if your blood pressure is only mildly elevated. Water pills are often prescribed with other medications. There are some things that you need to watch out for if you're on this medication. It's going to make you to pee a lot. That is why you usually take it in the morning. It can raise your blood glucose level as well as your blood uric acid level. It can also cause you to be dehydrated, so you need to stay hydrated. Evidence has shown that clothalidone is actually more effective than hydrochlorothiazide in preventing heart attacks and stroke. So next time when you see your primary care provider, ask for clothalidone instead of hydrochlorothiazide, often known as HCTZ. To the fifth class of antihypertensives, which are the beta blockers. These medications usually end in olol. Example, the metoprolol, atenolol, carvedilol. How do they work? They would usually decrease your heart rate as well as reduce the force with which your heart pumps. So with a reduction in your heart rate and the pumping capacity of your heart, it reduces your blood pressure. You will likely get a beta blocker if you have had a heart attack, if you have heart failure, if you have angina, if you are young and you have high heart rates, if you have anxiety problems because they are known to have a very calming effect, if you have AFib or any other abnormal heart rhythm. Of note, these class of medications are no longer first line for the management of high blood pressure alone. They are usually used if you have any of the conditions that I stated earlier. What should you watch out for if you're on a beta blocker? Fatigue. This is very common. It can also mask elevated blood glucose level. So people who are diabetic should be aware of this. It can also cause cold hands and cold feet. They can also worsen asthma and affect athletic performance. So, how does your primary care provider decide on what antihypertensive will work best to control your blood pressure? He has to look at your age. For example, if you are under the age of 55 and you are not Black, then ACE inhibitors or the ARBs are considered first. If you are over 55 or you are Black, then we think about the calcium channel blockers or the water pills first. He's also going to look at if you have any other chronic conditions. For example, diabetes. Then I have to look for ACE inhibitors or the ARBs. Do you have chronic kidney disease? ACE inhibitors or the ARBs? Are you asthmatic? Then I want to avoid the beta blockers. Do you have heart failure? Then I have to think about the ACE inhibitors or the ARBs plus a beta blocker and plus a water pill. Do you have atrial fibrillation, that is irregular heart rate? Then I want to put you on the beta blocker or the calcium channel blockers. Have you had a previous heart attack? Then I want to put you on the ACE inhibitors or the ARBs plus a beta blocker. Your race also matters. The Black people have been found to do better on the calcium channel blockers and the water pills, while the white people do better on ACE inhibitors. Your primary care provider will also have to look at the side effects that you can tolerate, as well as cost and convenience. The truth is, most people need 2 to 3 medications to have their blood pressure under control. Starting with one medication is just the first step. Only 1 in 3 people have their blood pressure under control with one medication. But good thing is most of these high blood pressure medications now come as a combination pill. That is one pill having 2 or 3 medications in it with different mechanism of action. There's something I need to talk about. If you are having side effects, do not just stop taking your antihypertensives immediately. The first thing you want to do is to call your doctor, because most side effects resolve within 2 to 4 weeks after your body has adjusted to the medication. Sometimes you only need to be changed to a different medication in the same class of drug. Other times, the side effects can be fixed by just adjusting the dose. Your doctor has options. Don't suffer in silence. And always remember that an uncontrolled blood pressure is more dangerous than the side effects of the medication. Remember, you are not just taking a pill, you are saving your future.